number one neighborhood PT. What's your name?
Cindy Lou Who.
Cindy Lou Who. What can we do for you today?
I'm here for my first evaluation
With who?
with Dr. Lou.
Okay, I'm ready for you. So I have some forms for you to fill out. The first one is a past medical history form, and then the second one is an exercise screening sheet.
Okay.
If you have any questions, just let me know. Otherwise, fill them out in our waiting area right there. Thank you.
Thank you. All set?
Yes, just finished.
Perfect.
Did you have any questions? No, pretty simple, pretty simple. Okay, I will take these and then I will give them to Dr. Luke. I will set these right here. And what I'm going to do now, I'm just going to take your blood pressure. Is this arm okay, or do you have a preference?
Yep, that's fine.
Okay, perfect. So alright, I got 115/70.
Okay.
Okay.
Is that good? Am I gonna live?
Yes, that is good. Okay, so we had 3 different forms for Cindy to fill out. The first was a Part Q and U form, which screens for risk factors associated with health. And then the second form was a past medical history form, which was to get an idea of any family history or background. And then the third was a pre-exercise screening form to serve as a baseline for an exercise program.
Hi, I'm Dr. Luke.
Hi, Cindy.
You can call me Kevin.
Okay.
All right, so what brings you here today?
Well, I want to get back into training for like a marathon, but my knees have become a little bit unstable, so I've kind of put off the training.
Okay. Did you have any injury to your knee before at any time?
No.
No? Okay, does it bother you at any other time?
Only when I'm running, typically.
Just one time? Okay. Well, hopefully we can address that with your exercise program. It says here in your medical history that you have osteopenia, and you have a family history of osteoporosis. Can you tell me more about that?
Yeah, my mom has it and my grandma has it.
Okay. That might affect our exercise prescription. Are you taking any medications for that?
Just some calcium.
Okay. All right. It also says here that you have an eating disorder.
Yeah. Oh my goodness, when I'm stressed out, sometimes I forget to eat. So, yeah.
Yeah, I understand. Have you ever thought of keeping a food journal?
No, but it's something I would consider.
Okay, that's a good idea. All right. So this is the Part Q and the pre-exercise screening forms. And we just have you fill these out to make sure that you're safe to exercise and you're safe to do the exercise testing.
Why would I have to do the exercise test?
Well, since you want to be going back to marathon running, we want to see what level you're at and how we can progress accordingly.
Okay.
So these papers say you're at low risk factor since you checked no for pretty much all things, so we can go ahead and assign you a exercise test.
Okay.
So the results of her Part Q show that she has osteopenia, a past medical history of osteoporosis, and she is low risk. Because she is low risk, we were able to send her for an exercise appraisal without any concern. And the factors affecting the test is that she has knee instability and osteopenia. Therefore, we chose the Astron-Rhyming psychoergonomic test because this will have low impact on her overall skeletal system.
We chose the Astron-Rhyming cycle test for 2 main reasons. The first being that since our patient's goal is to get back to marathon running, we need a measure of cardiorespiratory fitness. The Astron-Rhyming cycle test estimates VO2 max with high validity. We do this by having Cindy pedal at a constant work rate for 6 minutes. We then determine her steady state heart rate. From that, we can use a nonogram to extrapolate VO2 max. However, we have to keep in mind that maximal heart rate is mostly affected by age and not cardiorespiratory fitness. So we use a correction factor to more accurately estimate cardiorespiratory fitness. The other reason we chose the test over other similar tests of cardiorespiratory fitness, like treadmill testing or field testing, is because we didn't want Cindy to be participating in a high impact activity during the test. Since Cindy has knee instability, we are unsure of how her knee would tolerate walking or running. And also, Cindy has osteopenia and has a family history of osteoporosis. We want to be wary of high impact activities. The bike allows us to get a good reading of cardiorespiratory fitness without stressing skeletal structures and her knee. And additionally, the test is relatively easy to administer. We don't need a metabolic cart, we just need a heart rate monitor.
So the Ashton rhyming cycle test lasts 6 minutes. You're cycling at a rate about 50 RPMs, and measurements of the heart rate is taken during the 5th and 6th minute. These measurements are then averaged, and a nonogram is used to estimate the VO2 max. So Ms. Cindy Lou, we're going to do the Ashton rhyming cycle test. First, we're going to take your resting heart rate and blood pressure.
Okay.
And this will be good on your knee because it's going to take the compression off and it's not high impact, so you should be fine. We're going to be looking at your VO2 max here, and that's going to help us determine what intensity to make your exercise program at, and it's going to help us follow your cardiorespiratory fitness.
Okay.
We're going to put this heart rate monitor on you so we can monitor your heart rate during the test.
Okay.
Okay, so you've been at 50 RPMs now. It's coming up on the 5th minute, so I'm just going to take your heart rate here. All right, excellent.
Alright, so the test showed that you have a VO2 max of 47. So this tells us you're in the moderately fit category, and this will help us determine what intensity of exercise we should start you at. We'll start you with a moderate intensity exercise. Do you have a heart rate monitor?
Yes.
Great. We're going to go ahead and use that for your exercise intensity. It'll tell you what heart rate we should keep you at when you exercise. And so when you run and train, we want you to exercise at between 121 and 146 beats per minute. That's what the AC system recommended for people that are pre-osteoporotic. And that's 40 to 60% of your VO2 max. Okay, great.
We found Cindy's cardiorespiratory fitness is average. From this information, we have decided to start her at a moderate work intensity and slowly progress her until she is able to perform at a necessary intensity. We also keep in mind that she has osteopenia, and we will prescribe her body weight exercises to help combat development of osteoporosis. We also took baselines for flexibility and strength via manual muscle test on her lower extremities.
Although there aren't any red flags with this population, there are some special considerations that we want to take into account. We want to avoid any exercises that include explosive movements or high loading impacts, because this could injure the skeletal system. Also, we want to avoid movements that cause twisting, bending, or compression on the spine in patients with severe osteoporosis. However, Cindy does want to get back to running, which has some degree of impact on the skeletal system. Therefore, we are adding resistance training that should help combat the development of osteoporosis by enhancing bone growth and slowing the rate of bone loss, so that we can safely get her back to running. It is also important to mention that risk of falling is very important in populations with high osteoporosis, but Cindy's not at a fall risk, so our attention is mostly based on preventing osteoporosis.
Okay, Ms. Cindy Lou, the first exercise we're going to do is squats. We're going to do this 10 times for 2 sets, and we'll progress to 3 sets eventually, okay? So you're going to hold this squat for 3 seconds. So the way you're going to do it, you're going to have your feet shoulder width apart. You mind holding this for me? You're going to keep your back straight, and as your back is straight, you're going to squat as if you're sitting down into a chair with your arms out in front of you. Hold 1, 2, 3, and back up, okay?
Okay.
All right, so now if you just don't mind showing me so I know that you understand it. Feet shoulder width apart, back nice and straight, and sit down as if you're sitting into a chair. Perfect. Awesome. And just remember you're going to hold that for 3 seconds, and then we'll progress to the 3 sets. Okay, the next exercise we're going to do is a lateral walk using a resistance band. So you're going to do this also 2 sets to start, 12 steps each way, and we'll progress this to 3 sets also. So what you're going to do is you're going to keep on holding this. You're going to have feet in this resistance band here, down around the ankles. And as your back is nice and straight, a little bit of a bend in the knee, and you're walking just like this. Okay, 12 steps one way, 12 steps the other way. Okay. Back nice and straight. Perfect. Okay, so the next exercise we're going to do is called ball squeeze, and we're going to do this laying down on the table. So if you don't mind just getting down there quick. Alright. And we're going to put the ball between your legs here. Okay, and you're going to squeeze together, and you're going to hold that for 3 seconds. You're going to do this 10 times for 2 sets, and we'll progress to 3 sets. Okay. So the next exercise we're going to do is going to be a bridge with a ball roll. So you're going to lie on your back on the table here, with your feet up on the ball, and put your hips. Okay, and now bring your heels towards your butt. Perfect. And you're going to do this for 2 sets, 10 times, and again we'll progress to 3 sets. These next exercises are going to be working large muscle groups, and you're going to be using body weight to help combat the osteopenia. So this first one is going to be push-ups, but we'll start at the knee and progress to regular push-ups. You're going to be doing this 2 sets, 10 times, and it's going to look like this if you don't mind holding. You're just going to get down in push-up position. Make sure your arms are about shoulder width apart, back is nice and straight. You're going to come down to your hands and back up. So, let me just see you do that real quick, just so you have an understanding of it. Perfect. Okay, the next exercise we're going to do are planks. And we're going to do 2 sets of these, 15 seconds each, and we'll progress time on this one. So you're going to lay down on your belly, and then prop up on your elbows, and on the tips of your toes, lift your body up. Okay, and don't forget to contract your core, and keep your back nice and straight, very good. And you're going to hold that for 15 seconds, and that looks great. So, how about that flexibility?
I need some work.
Yeah?
Yeah.
All right, well, we're going to give you a few exercises to address that. This is going to be a towel stretch, if you don't mind just laying on your back here.
Okay.
All right, you're going to wrap this end around your foot and hold. And then keeping your leg straight, bring it up, raise it up as high as you can. Okay, that looks good, so you're going to hold that for at least 30 seconds. You're going to do this for 3 times. And you should be feeling a nice stretch on the back of your leg here. Great.
I got it.
So this next stretch you can do with a towel also. It's going to be for your calf. You're going to wrap this around the top of your foot here and hold on to that, sitting over the edge of the table, and bring your toes to your nose. You're going to hold that for at least 30 seconds. You're going to do this 3 times.
Do you think my toe will touch my nose?
You shouldn't touch your nose, but you should feel a nice stretch in the back of your leg here.
Okay.
So this next stretch is a quad stretch. Do you happen to have a belt at home?
I do.
You do?
Yeah.
Well, I have one here, and you're going to use it for this stretch. So you're just going to put it through the loop as so.
Okay.
And you're going to put it around your foot, lay on your stomach.
Okay.
I'm going to put this around your foot here. And you're just going to pull till you feel a stretch. Had a good one there?
Yeah.
And you're going to hold that for at least 30 seconds. You're going to do that 3 times also.
Okay.
All right, and do each leg.
Gotcha.
Okay. So, you more comfortable in this pose?
Yes, it's so hot outside.
So as far as your resistance exercises go, you're going to do those 3 days a week, and they will help strengthen your leg and help stabilize your knee. Okay? We're going to do your stretches. We're going to do those for flexibility 3 days a week. And you can just do those when you're done your resistance exercises if that's easy. Okay, and that'll help prevent further injury. Now endurance exercises though, we're going to do those 5 days a week, and we're going to start off with walking for 30 minutes. I want you to walk at a brisk pace that'll help get your heart rate up, but not to the point where you feel like your knee's going to give out on you. Okay? And once your knee starts getting stronger and more stable, we'll progress you to running to get you back in your sport.
Okay.
All right?
Thanks.
Okay, so do you have any other questions?
No, I think you covered everything pretty well.
All right, well, I'll give you your home exercise program to take with you. If you do have any questions, you can always give the office a call.
Okay.
All right? Well, it was nice meeting you.
All right, you too.
All right, see you later.
All right.
You don't see that every day.